The code blue came at 2:38 a.m. Room 804. Pulmonary embolism. Captain Richard Voss crashing hard, his oxygen saturation collapsing like a building in freefall. 88. 72. 59. The ventilator screamed its mechanical protest. The heart monitor sang its flat, terrible song. No attending surgeon in the building. The on-call team was 20 minutes out, and Voss had maybe 4 minutes before his heart stopped answering. Natalie Hayes didn't hesitate. She moved into the room like someone who had already done this in the dark with worse tools and fewer options. The crash cart arrived in seconds, wheels squeaking against linoleum. She called for a scalpel, for a tray, for someone to keep pushing epi. A resident froze by the door. A nurse tech stood holding supplies without moving. Natalie's voice didn't change pitch, didn't rise, didn't plead. It just stated fact. 14-gauge needle. Second intercostal space. Midclavicular line. Now. Things moved. The thoracotomy incision came next, a single precise cut along the 5th rib, opening the chest cavity with the kind of muscular memory that doesn't forget even when the mind tries to bury it. Her hands were steady as surgical steel. The scalpel hissed through skin and muscle. Blood pooled dark and fast. She wasn't thinking about protocols or attending physicians or the 43 years Cedar Creek Medical had operated without a floor nurse performing open cardiac massage in a patient room. Her hands remembered the Hindu Kush. They remembered a mountain cave at 3 in the morning. They remembered what it felt like to hold a man's life between your palms when that was the only option between living and dead. The ribs cracked as she opened the chest. Not broken, opened, like pages in a book. She could see the heart now, pale and still, beating wrong or barely beating at all. The lung was dark with fluid. Embolism. Massive. The kind that killed people on their way to the bathroom. The kind that made surgeons rich and families poor and nobody got saved. But she was already here. Natalie's fingers found the heart. She cradled it like something sacred, like something that had been entrusted to her by someone who knew what she was, who knew what she could do. The cardiac massage started, rhythmic, firm, the pressure exactly right to force blood through chambers that had forgotten how to pump. 1 compression. 2. 3. Her other hand reached for the balloon catheter. Someone had it ready. Good. They were learning. Massage only, she said. No compressions on the ribs. The heart. Dr. Prescott appeared in the doorway. He didn't move closer. He just stood there, watching, his face cycling through expressions like a man trying to compute something that violated every rule he knew. His mouth opened. His hand came up as if to grab her shoulder, as if to order her to step back and wait for the attending, as if protocols mattered more than the dead man on the table. Natalie didn't look at him. She didn't acknowledge him. She kept massaging. Epi is in, someone called. 1 compression. 2. 3. 4. The hiss of air from the balloon as she positioned it. The fluorescent lights buzzed overhead, casting everything in white-cold light. The monitor showed nothing but flat. She kept working. Her jaw was tight, but her hands were loose. Pain is information. Pain is data. Fear is information. She wasn't afraid. She was working. 30 seconds passed. Then 40. Then 50. The heart jumped. It wasn't dramatic. It wasn't the way they show it on television. It was just a flutter, a hesitation, a single defiant beat. Then another. The monitor went from silent to whispering. 80. 92. The rhythm steadied into something almost normal. She kept massaging, kept her hand on the organ like she was teaching it how to live again. Vitals? Her voice didn't shake. It didn't even sound like it had been through anything. It sounded like she was ordering coffee. BP coming up. 82 over 50. O2 sat climbing. 90. 94. 98. Get vascular. I need someone who can place a filter before this clot moves again. On their way. 7 minutes. Finish the closure. Get him upstairs. She stepped back from the table, her hand sliding away from the heart like she was letting go of something alive. Her scrubs were soaked with blood. Her fingers were red to the knuckles. She didn't look down at them. She was already thinking 3 steps ahead, already moving to the supply cart to grab what she needed for temporary closure, already calculating whether Voss would make it to the ICU or whether his body was going to betray him again before the vascular surgeon could thread a catheter into his femoral artery and place a filter in his inferior vena cava. Dr. Prescott still hadn't moved. She could feel him in the doorway the way you feel a storm building on the horizon. She didn't acknowledge him. Not a glance. Not a word. The closure took for minutes. Her stitches were tight and even. A resident tried to help and she redirected him without saying anything, just a movement of her hand, a shift of the tray, a recalibration of space. He understood. They all understood, in the way people understand things when they watch someone do something they've never seen done before and realize they're standing in the presence of something unusual. The transport team arrived at 2:58 a.m. They looked at the open chest, at the temporary closure, at Natalie in her blood-soaked scrubs, and asked no questions. Questions could wait. Voss was breathing. His heart was beating. His oxygen saturation was 98%. That was all that mattered. She walked with them to the elevator, hands holding the fall line steady as they moved, her presence like a ballast keeping everything from tipping into chaos. Voss was still unconscious, but his monitor was singing a song that meant he had time. The vascular surgeon was scrubbing in. The ICU had a bed prepped. Everything that needed to happen next was already in motion because she had held a man's heart in her hands and convinced it to keep working. When the elevator doors closed, Natalie turned back toward room 804 to begin the cleanup. Dr. Prescott was still standing in the doorway. She didn't look at him. She simply moved past with the blood-soaked supplies, the tray, the instruments. He didn't move to block her. He just watched. She could feel his eyes on her, cold and calculating, the same look he'd given her 3 months ago when she'd started her first shift in the basement-free clinic, that moment when his casual observation had shifted into something else. Something darker. She went back to room 804 to clean the blood from the walls. The room smelled like copper and adrenaline and the antiseptic they used for biohazard cleanup. The fluorescent lights buzzed their endless hum. Outside, Philadelphia slept. The night was still dark at 3:04 a.m. There were 6 hours left until the morning shift arrived, until the hospital woke up, until people started asking questions and expecting answers. Natalie wiped the blood from the monitor screen. Her scrubs clung to her skin, still damp. She reached for her collar to adjust it and felt the dog tag beneath her shirt, the broken chain, the single piece of metal she'd carried for 4 years since the day everything changed. She didn't pull it out. She just felt it there, solid against her chest, a weight that was familiar enough to be invisible. Her forearm burned where the cut was, the old scar that never quite healed right, that ached when the weather changed. She ignored it. Pain is information. She had work to do. By 3:16 a.m., the room was clean. The ICU monitors sang their steady song 3 floors up. Voss's heart was beating. His oxygen saturation was holding. The vascular surgeon had placed the filter 22 minutes ago, right on the edge of when complications usually started. It was textbook clinical work, the kind that meant he'd probably survive this. Natalie sat in the break room with a cup of cold coffee, her second pair of scrubs already on, her bloody pair in a biohazard bag. She didn't drink the coffee. She just held it, staring at nothing, her jaw still tight but her eyes empty of everything except maybe calculation. The room around her was quiet, just the hum of the refrigerator and the distant sound of a monitor from somewhere deeper in the hospital's nighttime heartbeat. At 4:15 a.m., she got up and went back to work. There were rooms to check. Patients to monitor. A 93-year-old in 412 with congestive heart failure who needed her vitals taken. a 12-year-old in the pediatric overflow wing with pneumonia who had been coughing so hard for 3 hours that she sounded like a seal. There was supply inventory in the basement to finish, medications to check, 100 small tasks that made up the invisible infrastructure of keeping people alive while the rest of the hospital slept. Natalie moved through the corridors like a ghost. Nobody stopped her. Nobody congratulated her. Nobody even asked her about what had happened in room 804. By the time Dr. Prescott's shift officially began at 6:13 a.m., word had already spread through the nursing staff in those quiet, careful ways that hospitals have of communicating. A thoracotomy. A floor nurse. Voss is stable. He appeared on the 3rd floor at 6:17 a.m., moving through the hospital with that particular kind of precision that men with power use when they're calculating something. He didn't go to the ICU. He went to the office of the hospital administrator, and he was carrying a printed document in a folder that looked 3 inches thick. Natalie was rechecking the medication logs when a resident found her at the pharmacy. "Dr. Prescott wants to see you," the resident said. "His office." "Now." Natalie closed the logbook and nodded. She didn't ask why. She already knew. She had broken every protocol in the textbook. She had performed a procedure that was outside her scope. She had done it without authorization from an attending physician, without a surgeon present, without following a single one of the 43 years of Cedar Creek Medical protocol that Dr. Prescott had built his reputation on enforcing. She reached up and felt the dog tag beneath her scrubs one more time. Then she walked toward his office to begin whatever happened next, her composure perfect, her face blank, her mind already 3 steps ahead of whatever charge he was going to bring, whatever documentation he'd already started preparing, whatever carefully constructed case he was going to build to make sure that what she'd done in room 804 at 2:24 a.m. would be treated as a violation instead of a save. She didn't know yet that Captain Richard Voss, the man she'd held back from death with nothing but her hands and her memory and the 4 years of knowledge she'd buried in her chest, was about to become the reason everything changed. But she knew how to wait. She knew how to be patient. She knew how to survive. 1 week after Natalie noticed the discrepancies in the pharmacy logs, the vials marked as used but never documented, the dosages that didn't match the patient charts, the pattern that spelled out something far worse than negligence, Dr. Prescott summoned her to grand rounds. Not a conversation. Not a meeting request. A summons, delivered via the charge nurse with the kind of tone that made other staff members suddenly very interested in their shoes. The amphitheater at Cedar Creek Medical held 40 residents. The tiers rose in a half-circle around the central stage where attending physicians presented cases. Natalie had sat in these seats twice before, always in the back, always invisible. Today she stood alone at the front while residents filed in, their eyes sliding past her with the calculated disinterest of people who'd already decided she didn't matter. Prescott entered like a man walking into a courtroom he owned. He wore the kind of confidence that came from knowing no one in the room could touch him, board certification from Johns Hopkins, a brother-in-law who ran the hospital's legal department, 15 years of accumulated favors that had calcified into institutional power. He didn't acknowledge Natalie. He went straight to the projection screen and pulled up her charts from the pediatric ward, 3 patients from the previous week magnified so large that her handwriting looked like the scrawl of someone careless enough to destroy lives. "This," Prescott said, circling her documentation in red marker, "is what happens when nursing staff forget their place in the hierarchy. When they believe protocol is optional." He tapped the screen hard enough to make the marker squeak. "Notice the incomplete timestamp here. The missing countersignature. Notice how Ms. Hayes documented anesthesia levels but failed to cross-reference with pharmacy records." He turned to face the residents directly, his voice dropping into that particular register that conveyed profound disappointment. "This kind of negligence doesn't just violate policy. It kills patients. Children, most often, because they can't advocate for themselves when adults fail to do their jobs correctly." Natalie's jaw clenched. That was all. Her hands remained at her sides, perfectly still. Her breathing didn't change. Her eyes didn't water. The only betrayal was that single muscle working in her jaw, and even that would have been invisible to anyone who wasn't looking directly at her. The residents, to a person, were not looking directly at her. Prescott walked closer. "Ms. Hayes, how do you respond to these documented deficiencies?" His tone made clear he didn't expect an answer. He expected capitulation. No response? Perhaps that tells us everything we need to know. He addressed the room again. "This is the standard we've allowed to slide in our institution. This is the baseline competence we're accepting. Unacceptable." He let that word hang in the antiseptic silence. "Effective immediately, Ms. Hayes is being transferred to the pediatric overflow unit. A more appropriate setting for staff requiring remedial supervision." The amphitheater exhaled collectively, the sound of 40 people relieved they weren't the target. Natalie turned and walked out through the side door, her scrubs moving with the kind of mechanical precision that came from spending years moving through hostile environments. Her heart was steady. Her breathing was steady. The rest was discipline. 2 weeks later, she was restocking supplies in the basement-free clinic when she approached the vending machine that had been there since her transfer. The glass was dark. No snacks visible. No drinks. The security guard from the night shift leaned against the wall nearby, and when she checked the machine anyway, he laughed, a sound like gravel in an engine. "Welcome to Prescott's dumping ground, sweetheart," he said, watching her pull her dollar back out. "Machine's been broken since he started sending people down here. Management don't fix nothing for the overflow staff. You notice that yet?" She didn't answer. She didn't look at him. She simply turned and walked back toward the supply closet, her breathing still measured, her composure a wall that nothing had breached and nothing would breach. The guard's laughter followed her into the stairwell. Other nurses who worked the basement rotation stopped talking when she passed. That happened now. Prescott's problem child, they called her when they thought she couldn't hear. It was meant to stick. It was meant to wear her down. The geriatrics ward came next. Night shift, when the building felt like it was held together by skeleton staff and fluorescent lights that buzzed like dying insects. She was running post-op checks on Mrs. Chen in room 407 when Prescott appeared in the doorway flanked by 2 security guards whose faces carried the particular blankness of men who'd been instructed not to think too hard about what they were doing. "Miss Hayes," Prescott said, his voice carrying the false warmth of a judge about to pass sentence. "I need to see your badge. You've been accessing systems outside your clearance. Pharmacy logs. Medication records. Care to explain why you're behaving so suspiciously?" She finished updating Mrs. Chen's chart. Took her time. Then she unclipped her badge and handed it to him. Her hands were perfectly steady. They were hands that had held a tourniquet on a femoral bleed in darkness, hands that had performed a needle decompression through a rib cage with nothing but a combat knife and someone else's blood under the fingernails. Prescott's anger looked like a house fire compared to that. "One more incident," he continued, turning the badge over in his hands like he was looking for evidence of her crimes, "and these gentlemen will escort you out permanently. These guards will ensure your exit is thorough and documented. Understood?" She nodded once. No words. No apology. No explanation of what she'd seen in those logs or why she'd needed to verify them. The silence between them stretched like a tendon pulled too tight. "Return to your unit," Prescott said finally, handing her badge back without meeting her eyes. "And stay in your lane." He left with the guards behind him, and Natalie could hear him speak to someone in the hallway before she was out of earshot. "Problem child," he said to one of the nurses at the station. "Can't even follow basic protocol. Probably unstable. Definitely unstable, actually. Mark it in the incident log." Mrs. Chen was watching her from the bed, eyes tracking Natalie's face with the kind of awareness that only came with 73 years of paying attention to how people were treated. Natalie finished the vitals check without expression. Patted the old woman's hand once. "Rest now. I'll check on you in an hour." An hour later, she was alone in the supply closet, restocking saline bags with mechanical precision. The fluorescent light overhead hummed its dying insect song, Prescott's threat sat in the back of her mind like a stone in her boot, manageable for now, but something that would wear a blister if she walked far enough. She reached beneath her scrubs and touched the dog tag on the broken chain that hung against her chest. Single tag, because that was all that had come back from the Hindu Kush for years ago. The other one was still in the mountain somewhere. Maybe in a grave. Maybe in Voss's possession. Maybe lost to snow and time and the kind of history that military tribunals tried to bury under rules of engagement and discharge paperwork. She pressed the cold metal against her sternum for exactly 3 seconds. Then she returned the supplies to the shelf and walked back to the ward with her composure intact. The mask was still perfect. The wall was still solid. No one at Cedar Creek Medical had the faintest idea that the woman they were pushing into the basement had once been qualified to call in airstrikes, had once held 17 lives in her hands at the Sanjin Valley COP, had once been the kind of person that people with stars on their shoulders called asset instead of problem child. The next morning, she received the patient assignment for the incoming surgical cases. One name made her hand stop mid-turn of the clipboard. Captain Richard Voss. Combat-related injury. Requiring emergency surgery. Military transport, 2 armed guards, clearance level marked classified. The surgical scheduler had written in red, special patient. Do not assign to problem staff. Prescott had already crossed it out and written her name instead. The military transport pulled into the Cedar Creek Medical loading bay at 11:43 p.m., unmarked and precise, a black SUV followed by 2 uniformed personnel in dress blues who moved with the economical efficiency of men trained to secure high-value assets. The emergency department staff paused. Nobody moved until one of the officers approached the intake desk and said 6 words, Captain Richard Voss. Combat casualty. Classified. The name hung in the fluorescent air like a blade suspended mid-rotation, and somewhere in the basement of the pediatric overflow unit where Natalie Hayes was restocking supply cabinets that nobody had bothered to label correctly in the first place, the temperature changed. She didn't feel it immediately. Not the way civilians do, not with some mystical sixth sense or premonition. It was simpler than that. The night shift had a rhythm, a particular pattern of footfalls, voices, mechanical sounds that her body had learned to process without conscious thought. When the rhythm changed, she felt it the way a musician feels a wrong note played 3 rooms away. The loading bay activity was wrong. Too organized. Too military. She finished counting the bandage rolls, 147, she always counted twice, and made her way upstairs toward the sound. By the time she reached the main floor, Captain Voss was already in Trauma Bay for a trauma surgical team assembling with the precision of a fighter jet maintenance crew conducting a pre-flight. Natalie moved into the hallway, professionally invisible, watching. The officers remained positioned at the bay entrance like human sentries. One of them caught her eye briefly, a man with the bearing of someone who'd stood watch in places where standing watch meant actual life and death, and then looked away without recognition. She was just a nurse passing through. Nobody worth noticing. The chart appeared in the bin 5 minutes later. She pulled it, moved to an empty corridor near the radiology alcove where the old printer hummed its broken song, and began to read. Combat-related injury to left lower extremity, 3 weeks post-trauma, now presenting with acute dyspnea and unilateral leg swelling consistent with deep vein thrombosis, blood clot, her mind translated automatically, with probable pulmonary embolism risk. Pre-surgical medication authorization required. Cardiothoracic on standby. And then the name again. Captain Richard Voss. JAG Officer, Eastern Regional Command, filed court-martial proceedings, July 2020, combat decision classified Hindu Kush operations, outcome upheld, defendant relieved of duty. She read the name 3 times. The paper felt thin in her hands, which was absurd because paper was always the same thickness. But it felt thin. It felt like it might tear if she breathed on it too hard. For years. For years of Cedar Creek Medical, for years of overnight shifts and vending machines that dispensed stale coffee and bathroom breaks she'd learned to schedule around physician rounds. For years of becoming invisible enough that a man could stand 10 feet away and see nothing but white scrubs and a name badge. for years of burying the woman who'd worn the uniform before the stethoscope. The dog tag beneath her scrubs moved against her collarbone. A single tag, rank and serial number, hanging from a broken chain she'd never bothered to repair. Some talisman of what? Proof she'd existed? Proof she'd survived? She lifted her hand to press it flat against her chest, feeling the metal against her palm through the layers of fabric, warm from her skin. One tag, because the other one had been unclasped from a wrist that no longer needed identification. Natalie set the chart down on the desk and walked toward Trauma Bay for without permission, without announcement, with the particular kind of authority that comes from not asking anyone's approval. The officers at the entrance registered her approach with the precision of trained security, ready to block, to question. She showed them her badge without slowing. Pre-surgical medication prep. I'm the night shift pharmacy liaison. Not quite true. Close enough. Her voice was steady, a woman reciting inventory numbers, a woman with nothing riding on this moment except maybe her entire existence. Inside the bay, Captain Voss lay on the gurney with his left leg wrapped in compression, his face grey with pain and oxygen deprivation, his chest rising in shallow breaths that told her everything about the blood clot's trajectory. He didn't look like a man who destroyed her. He looked like a patient. He looked breakable. She didn't stare. She checked the fall-line, gauge and flow rate, exactly right, and began calculating the medications he'd need if they were going to move him for surgery within the window where his circulatory system could still handle it. Heparin bolus. Lovenox for anticoagulation. Sedation for the procedure. The mathematics of survival. The language she'd learned when she was someone else, someone with a commission and a rank and a medical license earned in a field hospital in Paktia province where the only authorization that mattered was whether you could keep a soldier's heart beating long enough to get him to the next level of care. The surgical resident was consulting with the attending, some discussion about timing and whether they had a cardiac surgeon available or whether they'd need to helicopter him to University of Pennsylvania. Natalie moved with quiet precision, verifying the pre-surgical orders, documenting the medications, her hands remembering exactly what they were supposed to do in exactly the order they were supposed to do it. Her voice, when she spoke to the resident, was soft. Deferential. The voice of someone asking permission. Would you like me to draw up the heparin? I can have it ready. The resident nodded, already distracted by something on the monitor, and she moved deeper into the bay. Captain Voss's eyes opened when she approached with the syringe. Recognition didn't come immediately. How would it? She was just a nurse, and she'd been someone else the last time he'd seen her, younger and in uniform and standing before a board of officers while he read findings that ended everything. His eyes closed again. The medication took him under, a small mercy, this not knowing, this erasure. She continued with the second full line, the blood draws for coagulation studies, the fluid bolus that would try to push the clot through his pulmonary system before it lodged somewhere it couldn't be unplugged. Muscle memory. Her hands moved on their own, remembering not the hospital but the cave, the combat knife, the 3 soldiers who'd lived because she didn't wait for authorization. Didn't ask permission. Didn't care about protocols when the alternative was letting men die in the dark while she waited for someone with more authority to tell her it was acceptable to save their lives. The surgical team was preparing for transport to the OR. 2 surgeons now, they'd managed to get the cardiac specialist in. The officers remained at the threshold, and Natalie moved past them with the confidence of someone who belonged in this space, who'd earned the right through no achievement anyone could see on her CV. She had maybe 4 minutes before they took him upstairs. For minutes before the night shifted again into something she couldn't predict. She touched the dog tag one more time through her scrubs, a single gesture, barely visible, the kind of thing nobody would notice unless they were looking specifically for someone who was falling apart. She wasn't falling apart. Composure was what you did when the weight of the world tried to crush you and you simply refused to bend. Composure was standing in a bay 10 feet from the man who'd court-martialed you and preparing his pre-surgical medications like you were someone who'd never worn a uniform, never stood in front of the Hindu Kush and made a decision that cost everything. Captain Voss was being wheeled toward the elevators now, the surgical team moving with him, the officers conducting a security sweep of the surgical corridor. And Natalie Hayes, just a nurse, went back downstairs to finish her shift, her hand still resting against the place where the broken chain held the dog tag flat against her heart. But that wasn't the worst part. The worst part was that the night was only halfway over, and at 2:53 a.m., the monitors began their descent into a rhythm nobody in Cedar Creek Medical was prepared to survive. The alarm screamed at 2:11 a.m. Not a gentle alert. Not a suggestion. A full code cascade that turned the entire floor into coordinated chaos. Captain Voss's oxygen saturation had plummeted from 94 to 68 in 4 minutes. His blood pressure tanked from 120/80 to 72/41. The monitors painted the story in red numbers and falling lines. Natalie moved before the second alarm sounded. She didn't run. Running implied panic. She walked, precise, deliberate, every motion a step she'd taken in a mountain cave 4 years ago when blood pressure was just data and the man in front of her was already dead without her hands. She hit the code button with the flat of her palm. The intercom crackled overhead, code blue, room 804. Trauma team respond. Voss's eyes were already rolling back, his airway starting to collapse like a punctured lung. She tilted his head back, checked for obstruction. His jaw was slack. The ventilator wheezed its mechanical rhythm, trying to push oxygen into lungs that were failing faster than air could reach them. His chest wall moved, but nothing was reaching the alveoli. Pulmonary embolism. A blood clot had probably thrown from the surgical site. The CT the surgeons had ordered for tomorrow would have caught it. Tomorrow was too late. "I need the crash cart and a 14-gauge angiocath," Natalie said to the nurse running through the door. Her voice was level. Factual. "And prep the OR tray from room 806. I'm going to need a scalpel." The nurse's eyes widened. "Dr. Morrison is on call. He's 20 minutes out. Voss has 4. Natalie was already pulling the bedside monitor closer, checking the leads. O2 sat dropping. 62. 59. The ventilator alarm screamed in sync with the heart rate climbing as the muscle starved for oxygen. 56. Move. The crash cart came through the door on rubber wheels that squeaked against the tile like something dying. Natalie was already positioning her hands over Voss's sternum, checking landmarks, preparing for what she'd done once before in a place that no longer existed. The fluorescent lights hummed their electric song overhead, indifferent and constant. Then the doorway darkened. Dr. Prescott stood in the threshold, his white coat still crisp despite the middle of the night, his eyes moving from Voss to Natalie to the crash cart with the calculation of a man watching his perfect documentation crumble in real time. His voice came out low, controlled, the voice of someone accustomed to being obeyed. "Step back, Ms. Hayes." Natalie didn't look at him. Her hands were already moving, already feeling for the landmarks between the 5th and 6th ribs, the space where a needle could become a lifeline or a monument to hesitation. "Dr. Morrison is en route," Prescott continued. "You will step back and wait for the attending surgeon. That is a direct order." O2 sat at 51. The heart rate climbing toward 160, the muscle trying to compensate for oxygen that wasn't reaching it, trying harder and harder until the pump itself would fail. Natalie had watched a man die like this once. She'd held his hand afterward. His name was Patterson. He was 23 years old and from Tulsa, Oklahoma, and he died because a superior officer made the same mistake Prescott was making, assuming protocol mattered more than the person whose heart was currently flickering like a failing light. "Get everyone away from the bed," Natalie said. Her voice was different now. Not asking. Commanding. "I need a scalpel and 1 milligram epinephrine pushed 4. Prescott's face went tight. "Ms. Hayes, you are not authorized." She made the incision. The scalpel came up in her hand like it had muscle memory of its own. The blade was cold and sharp and it slid between Voss's ribs with the precision of someone who'd done this while lying in dirt under gunfire, who'd performed this surgery with a combat knife in a cave where the light came from flashlights and the floor was ice and rocks and blood. She cut through skin, through fascia, through the intercostal muscles. The sterile field opened. The thoracic cavity became accessible. 1 milligram epi going in, the code nurse said. Her voice shook. Nobody in Cedar Creek Medical had seen this before. Nobody except Natalie. O2 sat at 48. Natalie's hand slid into Voss's chest. The heart was in fibrillation, quivering like a muscle that had forgotten its purpose. She cupped the organ in her palm. It was smaller than people thought, a fist-sized thing that had pumped blood through a man's body for 43 years and was now trying to stop. Her other hand began the massage. Gently. Rhythmically. Not the aggressive compressions of standard CPR, but the careful, sustained pressure of someone who understood that hearts could remember how to beat if you reminded them properly. Squeeze. Release. Squeeze. Release. The room had gone so quiet you could hear the ventilator. You could hear the four-pump clicking its measurements. You could hear Prescott's breathing, sharp and controlled, from the doorway where he stood watching his career implode in real time. We have output, someone said. The monitor showed a pause. A moment of silence in the electrical world. Then, a rhythm. A single beat. Then another. The heart remembered. Sinus rhythm. Not perfect. Not stable. But alive. O2 sat at 54 and climbing. 57. 59. The breathing synchronizing with the heartbeat, the body remembering how to do this dance that it had been doing since Voss was a fetus in his mother's womb. Get him to the OR, Natalie said. She was already stepping back, already stripping off the gloves that were now stained with blood and the viscera of a man she'd saved. Notify Dr. Morrison we've got an active bleed. He's coming in hot. Prescott had not moved from the doorway. The stretcher arrived within minutes. The surgical team from upstairs with their eyes wide and their movements careful around Natalie, around the woman who had just performed a procedure that wasn't in the textbooks, that wasn't taught in the standardized protocols, that belonged to a different world than Cedar Creek Medical's climate-controlled hallways and liability insurance. They lifted Voss carefully, connected the portable monitor, rolled him toward the OR with Natalie walking beside him, her hand on his arm, her voice steady as she gave report to the surgeon who met them in the OR corridor. Field thoracotomy performed 2:52 a.m., CPR initiated, sinus rhythm restored at 2:55. Approximately 800 milliliters blood loss, controlled. Left anterior lateral approach, no damage to surrounding tissues that I observed. He's yours now, doctor. The surgeon looked at her. His name was Reeves. He'd been at Cedar Creek for 6 years and had never seen anything like what Natalie had just done. The way his eyes moved across her face said he understood something had shifted, something immeasurable and permanent. Good work, he said quietly. By morning, Voss was stable in the ICU with the blood clot removed, his chest closed by Reeves with sutures that would hold until his body learned to forgive what had tried to kill it. Natalie sat beside his bed in a chair that was not designed for comfort, watching the monitors as if her attention was the only thing keeping him breathing. His oxygen saturation was 92. His blood pressure was 1/61. His heart rate was 84. All the numbers that said a man would live. At 11:27 a.m., a security guard appeared at the door of the ICU. Ms. Hayes. His name tag said Patterson, which was not lost on her. You need to come with me. Natalie didn't ask questions. She checked Voss's monitors one final time, everything stable, everything normal, everything alive, and followed the guard out of the ICU, down the corridor, toward the locker room where her other life had been stored in a 4x2-foot space. 2 more security guards were waiting at her locker. They opened it methodically. Her spare scrubs. The coffee mug from last Christmas. The picture she'd taped inside the door of the Hindu Kush Mountains, the edge of it still bleeding off the sides of the frame because she'd only had one tape from her desk. They placed each item in a cardboard box. The guard spoke into a radio. Hayes' locker cleared. No items of concern. Proceeding to legal. The charge nurse walked past without making eye contact. Two residents who'd worked the code with her suddenly became very interested in the crash cart inventory. Natalie had been disappeared from Cedar Creek Medical before she'd even left the building. By noon, she was in her car in the parking garage. The envelope sat on her passenger seat, sealed with the hospital's official seal. She'd been afraid to open it while walking, afraid her hands would shake. Now, in the silence of the garage with the engine off and the sound of her own breathing filling the small space, she opened it. 43 pages. Incident reports. Witness statements. Psychiatric evaluation recommendations. Unauthorized medical procedures outside scope of practice. Violation of Hospital Protocol Section 4.2.1, Section 4.3.6, Section 5.1.4. Failure to wait for attending physician. Suspicious access to pharmacy logs on 7 separate occasions. Evidence of possible substance abuse based on erratic behavior patterns. Recommendation for immediate suspension pending full investigation by the medical board and state licensing authority. Every humiliation Prescott had orchestrated. Every transfer, every assignment to the basement, every moment of watching her stand quiet while he tore her down, all of it was documented. He'd been building this case since the pharmacy logs. Since before the grand rounds. Since the moment he decided that Natalie Hayes was a problem that required a solution. The parking garage was cold. The concrete beneath her car was stained with oil from 1,000 other vehicles and a few drops of her own blood that she didn't remember shedding. She turned the key in the ignition. The engine clicked once. Didn't catch. Clicked again. The battery was dying, or she'd left the lights on, or the universe had decided that forward motion was no longer an option. She put her forehead against the steering wheel. The dog tag slipped out from beneath her scrubs, where she'd kept it hidden through every shift, every humiliation, every moment of being just a nurse. It swung on the broken chain and caught the light, and the scratches on its surface were visible, not battle damage but time damage, wear damage, the accumulated marks of being carried next to a heart that remembered everything she'd tried to forget. Her hands were steady. Her breathing was controlled. But something inside her chest was trembling, something that had nothing to do with fear and everything to do with rage, the kind of quiet, controlled rage that had powered her through combat and surgery and the 4 years of trying to be someone other than who she was. 15 minutes passed. A security guard walked through the garage on his rounds, saw her car, didn't check on her. Her phone showed 17 missed calls from the hospital legal department and 3 from a number she didn't recognize. She stared at the phone. She had no one to call. No family. No friends outside Cedar Creek. No one who knew what she'd actually done, what she'd actually been. Natalie pulled out her phone to call for roadside assistance. Then she lowered it. She sat in the dead car in the cold garage and waited, because waiting was something she understood. Waiting was what soldiers did. Waiting for orders. Waiting for the signal. Waiting for the moment when everything changed. It came 3 days later, in the hospital's main conference room, when Prescott made the mistake of thinking he'd already won. The conference room at Cedar Creek Medical occupied the north corner of the 3rd floor, floor-to-ceiling windows overlooking Philadelphia's gray skyline, a space designed to intimidate through sheer institutional weight. The long mahogany table gleamed under recessed lighting. Hospital board members in pressed suits sat in careful rows. Legal counsel with leather portfolios. A court reporter's fingers hovering over keys like a pianist waiting for her cue. Prescott stood at the head of the table with a presentation clicker in one hand and a stack of 43 pages in the other, pages he'd been building for 90 days, pages that documented every protocol violation, every unauthorized access, every deviation from procedure that could justify what came next. He'd discovered her file 3 days ago. The credentialing system interfaced with the federal database during the mandatory investigation he'd demanded, and there it was, classified. A redacted name that resolved to Lieutenant Commander Natalie Hayes. Decorations listed in sparse military language. Dates and locations and operations that made his stomach drop because suddenly the woman he'd been systematically dismantling wasn't a nurse who'd gotten lucky with a cardiac arrest. She was something else entirely. something that had walked the same corridors for 3 months while he mocked her, threatened her, buried her in the basement. He'd filed anyway. The evidence was solid. The case was airtight. He had this. The gallery doors opened at 9:02 a.m. and Captain Richard Voss rolled himself through in a wheelchair, his naval dress whites immaculate despite the bandages visible at his collar where the thoracotomy incision had been closed. His presence alone shifted the room's pressure. 2 board members straightened. Legal counsel exchanged glances. Prescott's jaw tightened, but he didn't move, didn't object, didn't acknowledge that anything had changed. Voss positioned himself at an angle where he could see Natalie, who sat at the opposite end of the table in civilian clothes, her hands folded on the surface in front of her, her expression the same flat composure she'd worn through every humiliation he'd orchestrated. The board chairman called the hearing to order. Prescott began. He walked through the documentation methodically, unauthorized procedures, practicing beyond scope, the Grand Rounds incident where she disregarded his direct order, the pharmacy access log she had no business reviewing. His voice was steady, professional, the voice of someone protecting institutional integrity. 20 minutes of meticulous argument that built like a closing statement. When he finished, he sat down and pressed the button on his clicker as if he'd just presented an airtight case. The silence lasted 3 seconds. Then Captain Voss raised his hand. "I have testimony," he said. His voice carried the kind of weight that comes from command authority. Not loud. Precise. "I'm requesting permission to provide statement regarding events of the Code Blue." The board chairman hesitated, glanced at legal, nodded. "You may proceed, Captain." Voss didn't move from the wheelchair. 3 days ago I was brought to Cedar Creek Medical with a blood clot that should have killed me. I was prepped for surgery. Then the clot dislodged and my heart stopped beating at 2:33 a.m. He paused. The room's pressure changed again. I have no memory of what happened next. But I can tell you what happened before. For years ago, this woman, he tilted his head toward Natalie, was court-martialed by my office for a combat decision in the Hindu Kush. A decision I found fault with. A decision that ended her military career. Prescott's face went pale. He was calculating now, trying to understand how the past had walked into the present. Captain Marcus Holloway served as a field medic in Dark Horse Company, 3rd Battalion, 5th Marines, Voss continued. He was ambushed in the Korengal Valley. 17 enemy fighters. Heavy fire. 2 Marines down. Marcus was hit twice. He had 70 seconds of consciousness left. Then Lieutenant Commander Hayes appeared in that canyon and pulled him out of a crossfire that should have finished him. Voss stopped. The room was absolutely still. Marcus wants to testify, but his current deployment prevents it. So I'm reading his statement. She ran into that ambush knowing she'd already been court-martialed for the last decision like it. She did it anyway. I'm alive because of her. My 2 kids exist because of her. A chaplain in dress blue stood. Colonel James Hartwell, the nameplate read. He opened a leather-bound folder with the deliberate precision of someone presenting sacred documents. Operation Copper Dagger, he said, his voice carrying the cadence of someone who'd read these words at funerals. 3 months. Helmand Province. The operation had a 32% casualty rate among sister units. Dark Horse Company had 0 fatalities. The unit history documents for instances where field decisions made by Lieutenant Commander Hayes prevented ambush casualties. 3 soldiers survived extraction because she correctly identified threats the primary medical officer had missed. One of those soldiers was Sergeant Tommy Chen. He's now a dentist in Sacramento with 3 children. He exists because of her. Prescott stood up. This is irrelevant. These are. Sit down, the board chairman said. Her voice was quiet. Prescott Saturday. An admiral entered through the side door. Full dress whites. Combat ribbons covering his left chest like medals on a general's tunic. For stars on his shoulder boards. Captain Voss didn't salute from the wheelchair, but his spine straightened imperceptibly. This was Admiral Michael Torres, Joint Special Operations Command, attached to the Pentagon's Special Warfare Division. He took a position at the front of the room with a single sheet of paper. "I'm reading the official military record," he said. His voice sounded like gravel being poured into a metal bucket. "Defense Superior Service Medal. Bronze Star with Valor." He paused between each one like a funeral volley. "Second Bronze Star with Valor." Another pause. The second medal landed like an impact. The medal she never mentioned to anyone at this hospital. The room's pressure inverted. The air itself seemed to tighten around Prescott like a fist closing. He couldn't breathe. He couldn't calculate. He was watching his carefully constructed narrative dissolve into something he'd never understood, something that had been walking past him every day in scrubs and a broken dog tag and a face that never gave him the satisfaction of visible pain. A video feed materialized on the conference room screen. A laptop somewhere in the building connected to a feed showing a woman's face pixelated, voice masked. A CIA liaison. A code name spoken that made two board members immediately stand and excuse themselves to make phone calls in the hallway. The liaison spoke for 40 seconds about classification levels and operational security and a commitment that extended beyond civilian medical practice into areas this board does not have clearance to discuss. When the feed cut, the silence that followed was so thick you could operate in it. The room's energy shifted. The staff in the gallery had begun whispering, names they'd heard only as rumors, operations they recognized from briefings they'd been given about not discussing anything with the staff member in the free clinic basement. One resident who'd mocked her at the coffee station was pale. One attending physician who'd avoided her eyes in hallways was staring at his hands. The security guards who'd joked about Prescott's dumping ground were no longer meeting each other's gaze. Prescott sat frozen. His jaw was open slightly. His hands trembled on the table, actual visible trembling, the kind of physical betrayal that he'd spent 3 months trying to provoke from her and had never managed. His carefully assembled documentation sat in a stack in front of him, rendered obsolete by the simple fact of her existence, her service, her sacrifice, all of it unknown to him despite having access to the same federal database. He'd built his case against a legend and called it human resources discipline. The board chairman spoke. "Dr. Prescott, we're recessing for 30 minutes. When we reconvene, the hospital administration and legal department will present findings regarding the pharmacy discrepancies you've been documenting. You should have counsel present." By that evening, the video existed. A resident who'd filmed Prescott's Grand Rounds performance, his mockery, his threats, his physical attempt to physically stop Natalie from accessing equipment as Voss was coding, had posted it to the medical community's private forums with a caption, "This is what happens when ego matters more than patients." The timestamp showed Prescott's voice, "Step back, you're not authorized. This is my patient, my responsibility, my decision." Her voice, flat and absolute, "Your patient's dead if I don't move." The video shared 47 times in the first hour. By midnight, the number had climbed to 3,000. Comments from Cedar Creek staff appeared, the dumping ground, the reassignments, the vending machines that never worked, the way she'd pushed forward anyway. A Hopkins colleague flagged the video and forwarded it to Dr. Marcus Chen, Prescott's former medical school mentor and current department head at Johns Hopkins. Chen's response was public, written in the tone of a man closing a door on someone who'd been walking through it for 25 years. "I have watched this video. I have reviewed his record. This behavior represents everything I failed to teach him about medicine and humanity. I am publicly disowning his professional association with Johns Hopkins and requesting that any future reference to our relationship be stricken from the record." That single letter triggered an immediate Cedar Creek board review into the pharmacy logs. Hospital Legal pulled Prescott's records, anesthesia medications with discrepancies spanning 8 months. Diversion patterns that traced to a cosmetic clinic registered to his brother. DEA involvement within 48 hours. Federal investigators. Prescott's office sealed. His credentials suspended pending investigation. Criminal charges filed by the U.S. Attorney's Office for Drug Enforcement Administration violations. By the next morning, the video had 17,000 views. His wife appeared at Cedar Creek demanding answers he couldn't give. His attorney advised silence, absolute, total silence. The residents he'd commanded began avoiding him in hallways, their eyes finding the floor when he passed. The security guards who'd escorted Natalie from the building now escorted him to depositions. His name circulated through medical networks with the kind of velocity that destroys careers. He sat in his car in the same parking garage where Natalie had broken down 3 days earlier, his hand shaking on the steering wheel as he watched the view counter on the video climb toward 50,000. Rain drummed on the roof. The rotor wash of a news helicopter shook the structure as reporters gathered outside the main entrance. His phone wouldn't stop buzzing. His license review was scheduled. His criminal trial wouldn't begin for 8 months. In that moment, in the darkness of the parking garage with the rain hammering like judgment, he understood finally what he'd never seen, that the woman he'd been trying to destroy had been made of something that couldn't be touched, couldn't be humiliated, couldn't be broken because it had already survived far worse than a doctor's ego. 6 months later, Natalie Hayes walked into Cedar Creek Medical in trauma bay scrubs, the position she'd been reinstated to with back pay and formal apology. The dog tag still hung beneath her scrubs, but she no longer hid it. Residents greeted her by rank. "Good morning, Commander." She corrected them gently, "Natalie's fine." The basement-free clinic had been converted to storage, the vending machines replaced with something that actually worked. The Grand Rounds Amphitheater now displayed her field thoracotomy video as a case study in crisis decision-making. Captain Voss visited monthly for follow-up appointments, bringing coffee, beginning something like friendship. In the parking garage one afternoon, she saw Prescott loading medical supplies into a delivery van, Cedar Creek Medical Supply embroidered on his jacket. He'd aged years. Lost weight. Their eyes met for exactly 2 seconds. He started to speak. She touched the dog tag briefly, an unconscious gesture, and walked past without a word. Inside, a trauma alert sounded. She ran toward it, her team following, everyone moving with the precision she'd taught them. Her hand steady and sure as she started and fall line while the trauma bay doors burst open with the next emergency. The rain outside drummed against the windows. Her voice cut through the chaos with absolute authority. Trauma activation, ETA 2 minutes, multiple gunshot wounds, all priority 1. The room responded. They always did now. Because they'd finally learned to recognize a leader when they saw one. Don't forget to like and subscribe for more stories about the heroes we pass every day without knowing their names. Leave a comment. Have you ever been underestimated by someone who didn't know your real strength? I'd love to hear your story.